The ABCDE Approach. Airway. If the patient is talking to you even with one-word sentences, then their airway is patent. If they're not talking or crying to you and they are unconscious, look in airway for signs as an obstruction, where you could see a foreign body, vomit, loose dentures, signs of anaphylaxis, or a relaxed tongue obstructing the airway. The paramedic airway ladder is a stepwise approach that can manage a patient with an airway obstruction. Starting with positioning using the head tilt chin lift, or in the event of a possible C-spine, the jaw thrust, where both maneuvers bring the tongue forward and prevents it falling back. Suction can also be provided with blood, vomit, secretions, then moving up the ladder with airway adjuncts, op airway for unconscious patients and NP airways for conscious to semi-conscious patients. Thinking of oxygenation and using an eye gel for more advanced airway support. Breathing. It's important to determine the patient's work of breathing, as it can help establish any deterioration where we check their positioning, if there is any accessory muscle use, recessions, pursed lips, and their respiratory rate. Auscultating involves listening to internal sounds to assess airflow through the trachea and the bronchial tree. Interpreting the lung sounds heard over all 8 regions. O2 saturations can also help measure oxygen levels in the tissues, where low readings can indicate hypoxia, where oxygen can be given if indicated. Circulation. Skin color can reflect a patient's overall health and is an important part of assessing skin breakdown and wound healing. It's important to locate a radial pulse. Once located, check brachial pulse compare character and volume. If neither pulses can be found, locate the carotid pulse. Capillary refill can provide an overview on cardiac output. Blood pressure is the force that moves blood through the circulatory system. Readings can vary depending on the patient. Manual BP can be more accurate. Disability. The ACVP-U scale is a rapid method of assessing a patient's level of consciousness. Anyone who is responsive to pain or is unresponsive needs additional airway support. Blood sugar monitoring is one of the most important aspects of managing diabetes, especially type 1 diabetes. When checking the pupils, compare the reaction to stimulation in both eyes. When light reaches a pupil, there should be a normal, direct, and consensual response. Temperature can fluctuate depending on patient condition, which makes reading core body temperature of patients critical to understanding their current health situation. Exposure. A head-to-toe assessment is an exhaustive process that checks the health status of all major body systems. Use the sample acronym in obtaining a comprehensive history from the patient, which includes signs and symptoms, allergies, medications, past medical history, last oral intake, and events leading to incident. Subscribe to the channel for more